Hello, my name is Brittany Stewart, and I'm a member of the Nu Beta Omega chapter of Alpha Kappa Alpha Sorority Incorporated, located in Clearwater, Florida. Today I'm coming to you during Breast Cancer Awareness Month, which is October, to talk about the differences between the two most common types of mammograms. That would be screening mammogram and diagnostic mammogram. So, to begin, all women over the age of 40 should have a mammogram completed based on guidelines that your doctor will determine. There are different guidelines from different organizations that determine the frequency. Most common that are followed are the American Cancer Society, which is yearly. With a mammogram, if this is your first, you will be subjected to doing a screening mammogram, and that's what typically most women have yearly. A screening mammogram is just like it says, to screen. These mammograms are not looking for any suspected abnormality because there is no knowledge of anything that's occurring. Screening mammograms are completed just to rule out if there's any changes in the breast that would be suggestive of something more advanced to occur. The second level of mammogram is a diagnostic. A diagnostic, just as it says, is to diagnose. Diagnostic mammograms are present to look for abnormalities. As a nurse practitioner, I often hear my patients that will have mammograms completed as a screening and they will be called to come back, or I will receive notification to have the patient go back to the diagnostic center. When I tell them that they have to go get another mammogram, they often have a great fear and anxiety that occurs because they think something's wrong. So, reasons why you may be called back from a screening mammogram to get a diagnostic mammogram, which is very common to occur, can be because this is your first mammogram that you've ever done. This is a new diagnostic facility that you have used. Or if there's some changes in your breast that the radiologist is kind of questionable about if it's something that's stable, if it's something that's concerning, or if it's something that they just want to see some more information on. Screening mammograms usually are fewer views, so they are only looking kind of at subjective, so at the exterior. There are 3D mammograms, 2D mammograms, there's different types. So screening mammograms usually aren't looking more invasive versus a diagnostic mammogram. Usually you take quite a few extra pictures. You may have your breasts smushed a little harder. Or you may have an ultrasound done, and the ultrasound is used to kind of examine areas that that mammogram may not be able to catch. With a diagnostic mammogram and screening mammogram, you do get grades. So a lot of times we'll have grades of what we call BIRADS or BIRADS. That grading level can go from a grade of 0 to a grade of 6. And I'm going to explain what each level means now. So BIRADS or BIRADS, grade 0, basically means it's not complete. That means that you will have to go back to the diagnostic center to get some additional testing completed in order to figure out if there's something going on. So 0 means it's not complete, it's incomplete. You will have to follow up. I often have a lot of patients that will have a screening mammogram done and the report will come back as a 0 and they think they're done. And I have to go through education to tell them, nope, you're not done. You have to go back. You may have to get an ultrasound, you may have to get a diagnostic mammogram, you may have to get both. It all depends. A BIRADS grade 1 is basically negative. So that means there was really no findings in your breast that the radiologist saw that would suggest any concerns, and that you are good to go ahead and wait till the next time you do your screening, which may be 1 to 2 years. Grade 2 is benign. So benign means that although there are some changes in your breast, they're not anything that is abnormal to the point where there's a concern for any malignancy or cancers. So benign findings that may be present, maybe you have fibrous breast tissue or dense breast tissue. If that is occurring, then a lot of times you'll have BIRADS grade 2 on your paper, on a mammogram report. And that basically means that it's negative, but there are some changes in the breast, but not anything concerning. those individuals will also be told to come back in a year or two, just to do their normal screening. Level three, once you reach your level three, that means that there are some changes, a little bit more than just like fibrocystic tissue, that we want to check and see if there's stability. So grade three means you're going back to the diagnostic center. That is when we're trying to see short-term follow-up. So some people have a mammogram. They may go through and get a diagnostic mammogram, and we find, oh, there's a cyst in the breast. And that cyst may have not been there before, or it may have gotten a little bigger, or this is the person's first mammogram. If that occurs, then we usually will send that person back to the imaging center within 6 months, for a check for stability. Most people will have those type of checks done a couple times to get like a trend to see how the breast is looking over a period of time. Once that period of time has concluded, then we will go ahead and say you can return to normal screenings. So a three usually means you're benign, but you're going to be going back to the imaging center just to check and see if those changes that were noted have continued, or have remained the same, or have gotten worse. It's really just a close follow up. It's a level three. Grade four means that there's definite concerns that need further investigation. So grade four usually is when we start talking about biopsies. So we see something going on in the breast. It might be a cluster of tissue where you had a diagnostic mammogram done, still really wasn't able to determine what all was in there, or what all it contained. And that would be when the radiologist would say, come back for ultrasound guided biopsy. Biopsies can be done at a radiology center. They can be done by breast surgeons. They can be done in different settings. But basically, it's to try to get a piece of tissue from inside the breast to send off to the pathologist, or the doctor who looks and kind of finds abnormalities like cancers, or diagnoses different types of diseases. And that doctor would determine what that breast tissue contained. Is it something that's benign, where you don't really have a concern, or is it something that is malignant or cancerous? So grade four usually will require a biopsy to be done. Our BIRADS 4 will require a biopsy to be done. So you would have that done, and you would have your follow-ups. Usually you would be seeing somebody as far as a specialist or someone with that biopsy to help to kind of guide how we are going to determine your follow-ups afterwards. A lot of women who have biopsies, they will have clips put in. So where the biopsy was taken from, they'll leave a little thing in there, a little clip, a little piece of metal in there, or radiation proof plastic. I'm not really sure what it is, but they'll leave something in there to mark the spot where you had something previously done. That way, if a radiologist is coming behind them, they're able to see that, oh, yeah, this tissue looks abnormal, but they had something done. Let me go try to find out what happened. And that sometimes can save some grief down the road. And when women are doing follow-ups, and they will be able to see if anything's progressed, got bigger, or if things are the same, and they can determine from there. Now that was grade four. Grade five, definitely when you have a grade five, we're highly, highly, highly suggestive of cancer. So when a woman has a BIRADS grade five on a mammogram, that means they need to be going to a specialist, because repeat testing, you may have to get a repeat test, you may have to get an MRI or something, but that person needs to be getting to that specialist as soon as possible. So that's usually something that, as a nurse practitioner, in my clinical setting, I would be getting a call from the radiologist to say, hey, I got this highly suspicious mammogram. They just did it today. Usually that's how it happens. The person's at the imaging center, just left. They're calling me, and I'm having a call to the patient to say, hey, I need you to come in. I just got some word about your mammogram. It's disheartening, because sometimes there's periods that we could have caught things along the line if we had done mammograms, or had convinced that person to do mammograms a little sooner. But sometimes it's not. And that can be genetic reasons. That can be a number of reasons. So I always tell my patients when they get a diagnosis of this sort, don't beat yourself up. You didn't do anything wrong. It's just, it happened. And unfortunately, this is when we caught it. Grade six, there is a grade six, and we usually don't see it much often, but that's after we know that there is a history of cancer. There's been some type of breast treatment, and we're just basically doing follow up to make sure the cancer isn't coming back or isn't present again. So grade 6 is usually, we know cancer was there, it was treated, taken care of, and we're just basically just trying to follow up to make sure the disease hasn't progressed. So out of all of those from 0 to 6, most women are going to fall into a number 1 or 2, which means negative, benign, or at the beginning when you first get mammograms, you may become a level 3, which basically means that you're going to have to go back to the imaging center a couple times just to make sure things are stable. So screening mammograms, basically to kind of conclude, are to screen. They're for every woman. It's basically just to look for things and to see what is occurring in the breast as a screening tool, to rule out anything. A diagnostic mammogram, on the other hand, is when we're trying to diagnose something. We're trying to find something. So that may mean that we found something on a screening mammogram and we're trying to look and see as far as what it is. That may mean that you come in and you say, I have breast pain. That's a diagnostic mammogram. So I always tell my patients, if you're having pain in your breast, you need to let me know before I write this referral, because you do not need a screening. I need to see you for a diagnostic, a little bit more testing so I can see what's causing this pain. Diagnostic mammograms can also be used for a follow-up after a known cancer or after a known abnormality in the breast that somebody had a procedure for. So there's different reasons for both of those to occur. So the most important thing I want you to take away from both of these is that if you are called to do a screening mammogram and you're of or a certain age, don't be afraid. Please go get them, because that's the only way we're going to be able to detect breast cancer and get it treated early. So I always tell everyone, please don't be afraid of mammogram. And also, if you have a screening mammogram and you're called and said that, hey, you need to go back, go back. You only done one step of the process. You need to know what's going on so you can live a healthy life and take care of yourself properly. So please always, always talk to your physician, your nurse practitioner, your physician assistant, whoever you see for your care regarding your preventative screenings. They're also important, not only just in October, but all year long. So there are opportunities, there's programs, there's everything around that you can get these mammograms done and get follow-up completed. So don't let no insurance defer you. Just make sure that you're taking proper care of yourself and doing the things you need to do to live a healthy life. So in that, I'm going to conclude, and the next video will be coming to you to teach you how to do a self-breast exam, because that is also an important thing for you to know how to do properly. So I look forward to seeing you in that video, and I hope everyone is well and you stay well and you be blessed. Now you have a good day.